Good evening. Yesterday, I spoke about the WHO backtracking on its advice that asymptomatic carriers very rarely infect others. Of course, they had to backtrack and very quickly. We have enough data to point out that even though you are asymptomatic, you can transmit infection to other people. Now, there are two definitions has to keep in mind. The first is asymptomatic, and the second is pre-symptomatic. By pre-symptomatic, one means that, or one implies that the person has no symptoms to begin with, and at some point does have symptoms of fever, cough, malaise, body ache, etc. And therefore, the period before that person becomes symptomatic is known as pre-symptomatic. Now, the one nice piece of data has been published yesterday in the New England Journal of Medicine as a scientific letter from the Japanese. These researchers followed about 96 people who were present on that famous cruiser ship called the Diamond Princess. Now remember, the Diamond Princess had about 3,700 personnel on it, and of these 3,700 personnel, 711 became symptomatic. It was also found out that almost 60% of these 711 confirmed cases, 60% remained asymptomatic. Now, of these asymptomatic people, around 96 people were transferred to a hospital in central Japan. And also, apart from this 90-odd group of asymptomatic people, there were also 32 more people who were from the cabin crew. Now, what the researchers found was that of these people, of the 90-odd people who were asymptomatic, around 15% developed symptoms in 4 to 5 days. The classic symptoms of COVID-19, which means that they had fever, they had cough, some had malaise, some had body aches. So now we know that this group of 15% people was or can be classified as pre-symptomatic. 85% of these people remained asymptomatic. Now, of the 32 people from the cabin crew, of these 32 people, 25%, that is 8 people, developed a positive test, but remained asymptomatic throughout. So the message is pretty clear. That is, despite being asymptomatic, there is a chance, or despite being pre-symptomatic, there is a strong chance that you can transmit this infection. The next piece of data is also from a cruise ship. This cruise ship began its journey from Argentina, and the timing was around the beginning of the pandemic. So therefore, all the passengers and the crew were tested for fever and asked for symptoms before they boarded the ship. It was also made sure that none of the passengers had traveled in the recent past to cities such as Wuhan, Tokyo, or countries like South Korea, Iran, Hong Kong, and Taiwan. Now, the cruise ship was headed towards Antarctica. Around the 8th or 9th day, the first person became sick. And soon after that, in the next 3-4 days, almost 10 people became ill. These people were tested by an immune assay, a rapid testing kit, and all turned out to be negative. But the captain decided that the ship had to dock. Argentina refused entry for the ship. So the ship turned towards Uruguay and docked over there. The Uruguay government insisted that every person on the ship was tested by the PCR test. And it was seen that of the people who turned out to be positive, and this was around 125 people. 125 people were tested positive, and of these, it was found that 60% remained asymptomatic. 40% were symptomatic. And of the people who were symptomatic, 8 required hospitalization, 4 needed a ventilator, and 1 person died. The third bit of data, which I've already told you, is that from the American aircraft carrier, the Theodore Roosevelt aircraft carrier, which had 4,800 personnel. Of these 4,800, 1,100 people did get infected. And again, 60% of these people were asymptomatic, and 60% developed antibodies. So we have now a reasonable amount of data which suggests that a large segment of people who are infected remain asymptomatic. But despite the fact that they are asymptomatic, they are spilling the virus to other people. So one has to be careful when we ease the lockdown, or we unloosen or lift off the lockdown in the near future. And this is what is troubling the British government also. There are rumors that the chief medical officer, that is Chris Whitty, and the chief scientific advisor, Sir Patrick Vallance, may be asked to resign or may voluntarily resign. Because they are insisting that when the lockdown is loosened next week, the social distancing must be maintained at 2 meters and not less than 1 meter. The finance people, on the other hand, want that the distance between 2 people is reduced to 1 meter. The reason is simple. When the distance is reduced to 1 meter, you can accommodate more people in any setup, which means that the occupancy in a restaurant will go up from 10 to 15% to almost 70%. People working in offices will go up from 40% to almost 80%. Even a lecture hall, the largest lecture hall in London, apparently has 600 seats. Now, if you follow the 2-meter rule, then only 40 to 50 people can be accommodated. However, with the distance kept at 1 meter, then you can have almost 400 people accommodated in the lecture hall. So the message is clear that maybe the economics will demand that we, or rather the Brits, the English, reduce the social distancing from 2 meters to 1 meter. But it remains to be seen whether that is done or not. Because the problem is that the English do not want to be known as the country which had the highest death rate in Europe, accompanied by the worst crash in their economy in the last 300 years. Now, I'll leave it at that. And so I'll summarize this once again for you, that from this information in these ships, the cruise ships and the aircraft carrier, we know that a large chunk of patients are asymptomatic. Mortality is low. The aircraft carrier had only 1 person dying of the 1,100 sailors infected. The Argentinian cruise ship also had only 1 person die. I mean, as I've already mentioned, 4 were on a ventilator, but only 1 died. The details of these people, the one in the American aircraft carrier and the one death on the connected with the cruise ship going to Antarctica, is has not been provided. So I will leave you with all this information. Thank you very much.